January is Cervical Cancer Awareness Month, a time to learn, discuss, and take action on an important health issue that affects many people. Dr. Nicola Mercer, the Medical Officer of Health in Wellington, Dufferin, Guelph, joins us to talk more about this. Dr. Mercer, thanks for your time.
Oh, thank you for having me to discuss this very important issue.
Yeah, and for those who may not know, can you first tell us what cervical cancer is and who's at risk?
Yeah, so cervical cancer actually is a cancer of the cervix, which is what women have. It's attached to sort of at the end of the vagina and attached to the uterus. And so this is a specific cancer that affects anybody who has a cervix. And cancer of the cervix can affect anyone, but predominantly what we see is actually a disease of young women, often women in their childbearing age. So when they come to attention, the treatment for it could affect their fertility, and it can be very devastating, but they're often young women, not exclusively, but that is the dominant cancer that we see.
So with that, who should be getting screened and how often?
This is a really good question. So the screening test has changed and it's a totally different test. So we know that cervical cancer is actually caused by a virus. So this virus, the HPV, human papilloma virus. So in the old days, we actually looked for cancer cells. In the new way of screening for cervical cancer, we screen for risk by looking to see if we can find this virus, because we know that the vast majority of cancer cases are caused by the virus. So we like to screen anybody who has ever been sexually active, any woman, anybody with a cervix who's ever been sexually active. You need to speak to your primary care provider and they will screen you. Now, with the new test, if we don't find that you have ever had the virus, then actually they may prolong your next test till as long as 5 years. But if they do find the virus, it now gives us a whole bunch of other options as to increased awareness, increased screening, potentially even vaccination to help you manage this virus. So it's quite a different process, and it's really targeting what is the root cause, which is the HPV virus.
How effective is that regular screening at actually prevention and preventing cervical cancer?
Well, screening doesn't prevent anything. Screening is just a way for us to find out early that you already have it. What we really want to do is prevent cervical cancer. And there's actually a vaccine that does that. It's the HPV vaccine, and it prevents not just cervical cancer, but a whole range of cancers that are caused by this very pesky virus, HPV. And so what we're hoping is that right now, we're just getting ready to go into our schools in February for the grade 7, grade 8 vaccine program. So we'll often be in the schools, we'll be doing it in grade 7, catching up in grade 8, but we're trying to vaccinate young people against this virus, because this virus causes a lot of cancers and they show up later in life, often in young women. Head and neck cancers can show up in the 40s, sometimes in the 50s. Very devastating cancers that are preventable with a simple vaccine that is free and that is easy to get by just signing up your child while the nurses are in the school to get your child protected from this particular cancer-causing virus.
So you talk about that younger age group being eligible for that vaccine. Is it ever too late to benefit from it if you don't get vaccinated in that grade 7-8 range?
Interesting question. So first of all, if you don't get vaccinated in 7-8, you are eligible for a free vaccine right up into the end of grade 12. And some drug programs will actually, so if you've got benefits and you're in your early 20s, yes, we can probably still vaccinate you. If you are at risk, if you wonder whether you're at risk, I really encourage you to speak to your primary care provider, because you may be still eligible. Actually, the vaccine can be given right through up until into the 40s for people who are at high risk or want to minimize their risk from the cancers that are caused by this particular vaccine. But those are not publicly funded. Publicly funded right now is up to the end of grade 12. If you want to have it at your family doctor's office rather than through a public health school-based clinic, we will accommodate that. But really, I want you to think about this vaccine prevents your child from getting a cancer later in their life. And I think that as parents, we all want to protect our children from cancer.
Are there any warning signs that women should watch for, or is this type of cancer one that develops silently?
Interesting question. So, for the most part, it is a silent cancer. And when women come to medical attention, the cancer can be quite extensive, especially if they haven't been having regular screening. So, if you've been screened regularly, we'll often catch it early. But again, it is far better to prevent a cancer than to treat a cancer. But for those who choose or are not able to get screening done on a regular, consistent basis, and they present later, it can actually be quite devastating. So they can present with pain, they may present with lumps in their groin, which is a cancer spreading, or potentially even vaginal bleeding, something that they're not expecting. But yeah, it's kind of a silent cancer until later in the disease.
Okay, well, it's certainly an important topic and timely to talk about it during Cervical Cancer Awareness Month. Dr. Mercer, thanks so much for your time. Dr. Nicola Mercer is the Medical Officer of Health in Wellington, Dufferin Guelph. Thanks again.
And thank you.